Alginate belongs to the group of hydrocolloids and is irreversible in nature. Alginate is most widely used impression material in dentistry as it is relatively cheap, easy to manipulate, and is more comfortable for the patient. Alginic acid is a biopolymer from a marine source. It is extracted from brown sea wets. Talking about the composition of alginate, alginic salts of sodium and potassium is the chief active ingredients. It reacts with calcium to form calcium alginate gel. Calcium sulfate releases calcium ions to react with alginate salts. Sodium phosphate acts as a retarder and reacts with calcium ion, delaying the process of gel formation. Fillers in the form of diatomaceous earth and zinc oxide increase the strength and stiffness of the impression. Potassium sulfate improves setting of gypsum, flavoring agents to improve the tastes, and chemical indicators change the color of the mixture, indicating different stages of manipulation. The setting of alginate occurs via gelation reaction, which we have discussed in previous video. After mixing of powder and water, soluble alginates dissolve in water to form sole, which is quite viscous. Calcium sulfate releases calcium ions, and these released calcium ions now react with alginate to form calcium alginate, which is the gel state. Here is the setting reaction of alginate. Sodium alginate reacts with calcium sulfate when water is added and gives us calcium alginate. Calcium alginate is insoluble and forms the gel state. Fibrils of the gel are linked together by calcium ions. So basically, calcium ions cross-links the polymer chains of alginic acid. Now discussing its clinical uses, it is most widely used for taking impression for partial denture prosthesis and can be used for complete denture, but it doesn't give us the fine detail in case of complete denture. It is commonly used for steady cast impression in orthodontics. It can be used for crown and bridge work, but elastomeric impression material is preferred. About the properties of alginate, alginate can record fine details of the mouth, including the undercuts, but tearing occurs in case of deep undercuts. So, for deep undercuts, we will prefer elastomeric impressions. Early removal of the impression can cause distortion of impression. So, to avoid it, the impression tray is held firmly in position until the final set. It is non-toxic and non-irritant. But the impression is not stable on storage due to synersis, and when placed in water, it causes imbibition. Synersis and imbibition are discussed in the previous video. It has good compressive and tear strength. It can be disinfected by 1% sodium hypochlorite or 2% glutaraldehyde solution. Moving on to manipulation of alginate, the container of alginate containing powder is shaken well before use. Equal parts of water and powder are taken out. Mixing is done in the rubber bowl with the spatula, and spatulation is done by spreading the material against the side of the bowl. 45 seconds to 1 minute is the spatulation time and is done till a smooth creamy mixture is produced. Material is loaded in perforated tray and impression is taken by applying a uniform pressure. The tray is held in position until the final set. The set material is displaced sharply from the tissue by snap action. Now let's discuss some MCQs related to the topic. The chief ingredients of irreversible hydrocolloid is calcium sulfate, sodium alginate, potassium phosphate, zinc oxide. So the right answer is sodium alginate. It can also be given as potassium alginate, which is also the correct answer. Alginate impression material deteriorates rapidly at normal temperature, elevated temperature, low temperature. Temperature do not cause any change in shelf life. Elevated temperature is the right answer. High temperature and moisture both deteriorates the material, so the material is kept in tight container and at normal room temperature. When alginate impression is to be taken in winter, the best way to control gelation time of alginate is to add a retarder or increase or decrease water to powder ratio or to alter the temperature of water. So, altering the temperature of water which is used for mixing alginate is the right answer, as increasing or decreasing water to powder ratio can cause change in the properties of alginate. Perforated impression trays are used for agar, impression compound, alginate, or zinc oxide eugenol paste. Perforated impression trays are generally used in case of alginate. Normal temperature of mixing water of alginate is. If you know the answer, pause the video and write it in the comment box. So the right answer is 18 to 24 degrees. Reactor used in alginate hydrocolloid is. So the right answer is calcium sulfate, as calcium sulfate provides calcium ions which reacts with alginate to form calcium alginate.